and we're out here. The connection you feel when you relate to another on a deep level.
Bringing a smile to their face, making them feel special.
Keeping our 6-foot distance or yelling across the street.
Hello and welcome back to another episode of Kidsley News. Today we have another special episode for you guys. Joining us in a Zoom call for an interview is Mr. Joshua Sumner. Hello, how are you doing today?
Hey, I'm great. Thank you for having me tonight.
No problem. It's nice to meet you, by the way. So, can you please introduce yourself to our audience so they can get to know a little bit more about you?
Sure. So as you mentioned, my name is Joshua Sumner. I'm a recent graduate from the University of South Carolina College of Pharmacy, and I am now a pharmacist at Brisson Drug in St. Paul's, North Carolina, kind of between Lumberton and Fayetteville, small community.
So, speaking of college, what is college life like?
Oh, wow. It's certainly for college life, especially undergrad, it's your first chance of independence, seeing, real responsibility, taking care of things that maybe your mom or dad that had the chance to remind you of when you're in high school or middle school, to do or follow up on. It's your first dose of reality, I guess you would say. I know that's probably to beat a dead horse that you probably heard that, but a chance to really dive in head first and kind of figure things out for a small dose of the world. But the cool thing is that you're around other, especially obviously in undergrad, 18, 19, 20-year-olds that are figuring out together. So there's lots of opportunities to grow as friends or communities that you are involved in. So it's pretty neat experience for sure.
So any tips out there for future college students?
Absolutely. If people who are still in high school, to challenge yourself, to be involved as much as you can, to figure out what actually interests you, whether that's community service, involvement groups, with volunteering, or even if it's something that you've always something that you like to work on, or to be actually to have a job on the side. I know a lot of friends that I had in undergrad, they also had jobs or did research, and all kinds of other things that they were involved in, to find people that you could meet and experience all kinds of new experiences with. But while you're in high school, I would certainly recommend doing as much as you can, to not to say stay busy, because you're only in high school once and you should absolutely enjoy it, but also to see kind of what it means to wear multiple hats and kind of balance your time wisely. So once you transition into college life, and then eventually into a career, that you see that learning to balance and wear multiple hats is probably going to be important for you, whatever path you choose to go down.
Right. So as you're a recent graduate and now you are a pharmacist, can you tell us a little bit about what you do as a pharmacist?
Absolutely. So pharmacist, for people who aren't aware, we're kind of an intermediary between your doctor or your provider, whether that's people that are nurse practitioners or physician's assistants. A lot of times we receive prescriptions from those providers, where we have the chance to we fill the medication, we talk to our patients, we get, a lot of times, especially in a small community where I am in St. Paul's, we get to learn a lot about our patients, and then there's a lot of chance for us for some clinical things where we can make interventions along with their providers, and work with their doctors to ensure the best care for the patients. And then one of my favorite parts is we deliver medications. So I know our delivery drivers have really wonderful rapport with our patients, where they are excited to see them, because a lot of times some of these patients we don't get to see them as much in person, due to sometimes transportation issues and sometimes health issues. But we get a chance to kind of speak through and see through our delivery drivers, which is pretty fun to hear, when patients are appreciative of what we do, and helping them in all of their healthcare needs as best we can.
So as we're going through this pandemic, how has COVID-19 impacted your job as a pharmacist?
Absolutely. So I actually, to end my scholastic career, I was at McLeod Health, which is in the one I was at was in Dillon, South Carolina, just across the border into South Carolina. And the end of my last rotation in school was actually cut short. It was cut basically in half, and I finished out the remainder from home. So it never really felt. And then we didn't have graduation. We had virtual graduation. So very much like this tonight. This is how graduation went. They said our name, showed a picture of us, and they're going to send us our diploma in the mail. So obviously very different than a typical graduation. But moving forward into that, as I started as a pharmacy graduate intern and then into a pharmacist in the past 2 weeks, we actually had our store was actually closed to the public, and our clerks or customer service representatives were actually running back and forth from the parking lot and our parking spaces in and out with patients' medications. We were wearing masks, trying our best to social distance. So we didn't have actual patients in the store, which, if you ask our clerks, it was a lot of running for them, especially as at the beginning it wasn't so bad, but as it got into May, it started when we had 90-degree days. It was very hot for them. So thankfully we are now open to the public. We're still limiting we try to limit about 4 to 5 patients into our waiting area at the time. We have the plexiglass up to protect our ladies up front who are our clerks who check the patients out, and then also at our drop-off window. So we're able to still talk to the patients. We recommend wearing masks into the pharmacy, but we are not requiring it right now. And then of course asking patients. We have the X's on the ground on our floor to ensure that patients at least give them the chance to social distance as best we can. And then for today, I gave an immunization to a patient where, of course, I'm going to be close to them. So, he had a mask. I made sure to wear my mask. And then we got off. We have an immunization room in our pharmacy where we could distance from others. So it's been very interesting. I know for lots of businesses, especially healthcare, it hasn't stopped. There has been some working from home, but healthcare really, it's still been very hands-on. It's just been with ways to protect yourself. Of course, as healthcare providers, we needed to continue to provide healthcare as best we could while protecting our patients and protecting ourselves, while to not bring it home to our families, especially for those that have either young children or older parents, grandparents, etc.
So other than the glass and things like that, is there anything else that has changed in the way you interact with your customers?
I would say our patients are a little more skittish. We've had some older patients, they don't want you to step around it, and that's okay. And we don't choose to step around or step to the side of the glass. Now, some patients will and try to, they want to see you face to face, which is understandable because that's what we're used to and how we interact. But a lot of our patients have really amped up our patients that we deliver medications to. And now, more than ever, delivering over-the-counter medications, mask, hand sanitizer. Our pharmacy owner has done his best to keep us in supply of hand sanitizer and masks. That way, we can deliver, and our delivery driver does, similar to Domino's or Pizza Hut. We're keeping our distance. We're dropping it off at the door, maybe ring the doorbell, and then back up to if we have to have a conversation with them. The delivery driver will step off the front doorstep and have that conversation. So that's certainly been interesting, but I'm not sure, moving forward, I think there will be more and more until, really the coast is clear, until we can get started back to more being around people in an appropriate manner.
So are there any rules or guidelines that you guys have to follow that have maybe come up because of the virus?
I guess 2 weeks ago, we opened the storefront back to to patients coming in the door, but not necessarily that we had. We are a small, locally owned independent pharmacy, so we don't have so many policies and procedures as something as a company like a Walgreens or CVS, where they had procedures that they put in, very quickly. But for the most part, we're just following what the CDC says, the Centers for Disease Control, and following, social distancing, mask, using those blockades. Our pharmacy was set up, years and years ago. It's been there 50 plus years, where it made it very easy for our technicians and pharmacists to be separated by about 5 or 6 feet, just the way it was built initially. And then now adding those, adding that second wave of the barriers where the clerks are has really helped out in that aspect where you couldn't be the 6 feet apart. And then we've made it very apparent that we wanted to clean the store each day. So we've kind of rotated that role as to disinfecting, especially doors, door handles, chairs in our waiting room, just places where we know patients have touched a lot, or we touch a lot, refrigerator doors, things of that nature. We've tried to sanitize and do our best to keep our work area as clean as possible moving through. And to add to that, we actually have a clinic similar to a minute clinic in our pharmacy, where that has actually been shut down since the pandemic had started. And they shifted there was a provider there, a nurse practitioner, who has since moved to helping. He actually works for the hospital, and he shifted to helping with COVID testing. So this clinic is still shut down, and we're not exactly sure when they'll be back. So I know a lot of our patients have missed that for certain needs. Patients want to just come in. It makes it super simple, where they can come in, see the provider here in our clinic, and it's kind of a one-stop shop. So I know our patients will certainly be excited when that's back open, and they can come see him as they need it.
So as we're nearing the end of our interview, is there any advice that you would like to give to anyone who maybe wants to do what you do?
Absolutely. For me personally, I'm a very hands-on learner, and I would say something that you aspire to be, whatever that may be, if it's career or something that you want to grow in as a person, definitely dive into it and get some experience. If you're interested in seeing something, you want to be a firefighter, you want to be a pharmacist, you want to be an accountant, whatever that may be. If you have the chance and you're passionate about it, people, I know for a fact, and especially in healthcare, we learn from people who are older than us, that came before us, that learned, the people who are 50 years old taught the people who are 40 years old, who taught the people who are 30 years old, and down the line. And that's no different. And we have a great appreciation for people who came before us, who helped us learn. And I think, most people in healthcare were, whether it be nurses or doctors or physician's assistants, pharmacists, you could throw us all in, where someone else has helped us grow directly in learning what we are today and who we became. So I think most people would be very excited to have someone come shadow, volunteer, especially through a high school program, that they get maybe they get credit through their high school or through some sort of program that they want to shadow or learn more about before they really dive in. Especially if it's something that you think you're going to want to go to school, maybe to be a doctor, you're going to be in school and training for 8 to 12 years. I would certainly recommend that you want to check that out. Really get hands on and see what doctors do day in and day out, of what you feel like you have a passion for before you're diving all in. And just day one in college would be my best recommendation for younger people.
So on our channel, we like to give our guests a chance to send any wishes to loved ones, family, or friends. Are there any that you would like to send?
Oh, absolutely, yeah. I'm excited that I was connected with you through my sister. I think,
Yeah.
and maybe my mother as well. So, shout out to my mom and my sister, and then of course my amazing coworkers. Since we've talked about this a lot at Brisson Drug in St. Paul's, North Carolina, because there's been some busy times and some hectic times during this, but there's a light at the end of the tunnel, and we're excited to move forward and hopefully move through as a country through the end of COVID.
Right. So since we're still going through this pandemic, we have this phrase that we like our guests to say. It's stay home, stay safe to help save lives. Can you please say that for us?
Okay. Stay home, stay safe to help save lives.
There we go. Well, thank you so much for joining us in a Zoom call. We really appreciate it, and we hope that you enjoy the rest of your evening.
Absolutely. Thank you. And I appreciate you reaching out, and it seems like you're doing a wonderful job. Absolutely. And you have a wonderful evening as well.
Okay. Thanks for watching this episode of Kidsley News. We hope you enjoyed it. For more videos like this, make sure to hit the subscribe button, the like button, and that notification bell. Make sure to check out Kidsley News Instagram account at Kidsley News. The link will be down below in the description. Make sure to go check it out. Make sure to share this video with others so that Kidsley News can grow. Thanks for watching this episode of Kidsley News. Hope to see you soon. Bye. And thank you once again for joining us in the Zoom call. Really appreciate it.
Absolutely. Thank you.
No problem.